So you're getting ready to start using Medicare as your primary insurance. It doesn't matter if you are just turning 65 or if you are over 65 and have been enrolled in your employer group health plan, starting Medicare is a big deal. It's normal to be a little anxious. The enrollment rules and timelines can be confusing, and a lot of people make at least one mistake in the process, and that is what I'm here to help you avoid. In this video, I'm going to go through the 5 most common mistakes that we see people make when starting Medicare and how easy it is to avoid them even long after you've seen this video and forgotten some of the details. Now, the 5th mistake that I'll be talking about here and in this video not only happens with people that are new to Medicare, but we've even seen it happen with people who have had their Medicare for a year or two and really should know better. So let's get started. If we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org. We're one of the country's premier insurance agencies specializing in Medicare. In fact, I'm licensed in every state except Massachusetts. Sorry, Massachusetts. And our services are free to you, the consumer. So please reach out to us for expert guidance. You'll be glad you did. Let's get started with a very common mistake, missing an enrollment period. This is a mistake I blame entirely on Medicare and its patchwork structure. Now, why is this a common error? Because there are a gazillion different enrollment periods. The mistake of missing or misunderstanding your initial enrollment period is not uncommon. There's one initial enrollment period for original Medicare, that's Medicare A and B, but you don't have to get them both at the same time because for most people there is technically no enrollment period limitation for Part A. Confused already? I know. So there's another enrollment period for Medicare supplement plans with a different time frame than any other enrollment period. And then there's another enrollment period for Medicare Part D prescription drug plans and Medicare Advantage plans. Now, this is critically important to understand if you are over 65 and leaving your employer group plan, and that's part of mistake number 3 that I'll talk about shortly. To help you understand, let's start with this basic concept. Everyone must enroll in Medicare during their initial enrollment period unless they have other creditable health insurance. Your initial enrollment period is a 7-month window around your 65th birthday month. Creditable health insurance is typically employer group coverage with an employer who has at least 20 employees. Also, you must be actively working past age 65 for any insurance to be creditable. Insurance as a retirement benefit doesn't count. Neither does COBRA. I have a great one-page flyer on creditable coverage that's linked below, and you should also be able to find it, a link to it above my left shoulder. So you must actively or manually enroll in Medicare, usually through the Social Security website or a local Social Security office. The only people who are automatically enrolled in Medicare are those who have received their Social Security income for at least 4 months prior to their initial enrollment period, or are under 65 and on a Social Security disability income for at least 24 months. So to recap what I just said, everyone must apply for Medicare during their initial enrollment period unless they choose to retain creditable employer health insurance working past age 65. If you are receiving Social Security income, you'll be placed on Medicare automatically. The same if you're under 65 and have reached your 24th consecutive month of disability income. So let's look more closely at your initial enrollment period. I mentioned your initial enrollment period is a 7-month window around and including your birthday month. The exception to this is if your birthday is on the first day of a month. In that case, your Medicare starts the first day of the month before your birthday. Now, do you have to memorize all of this? No. I have a free online calculator that will show you your initial enrollment period. Just go to MedigapSeminars.org, put your mouse cursor over the Resources menu and click Medicare Calculator, and you find your Medicare initial enrollment period by inputting your birthday. For example, if your birthday is December 15th, 1959, you find the year, 1959 first, then the month, then the day. Your Medicare start date in this case would be December 1st, 2024. You can enroll in Medicare Part A and Part B anytime between September 1 and March 31. After that, if you've missed your initial enrollment period, you must wait for the annual general enrollment period, which is from January 1 through March 31, the first calendar quarter of every year. I mentioned earlier the exception of when your birthday falls on the first day of a month. So we go back and we change the birth day to December 1st, you can see that everything moves forward by 1 month. Your Medicare start date changes to November 1, and your enrollment period is from August 1 through February 28th. Again, this is on my website, MedigapSeminars.org, under the Resources menu tab. Last point on this is that you are not required to enroll in both Medicare Part A and Part B at the same time. For most people, Medicare Part A inpatient coverage has already been paid for through payroll taxes during your working years. That's what the Medicare deduction from your paycheck covered. Because you've already paid for Part A, you can enroll in Part A at any time during or after your initial enrollment period. A word of caution: after your initial enrollment period, or after actually your start date for Medicare Part B, when you enroll in Medicare Part A, it can start retroactively either 6 months or back to your Medicare start date, whichever is soonest. I have more on that in your Medicare Enrollment video that I've done, and I'll try to stick that up here too. So let's look at the second common Medicare enrollment mistake. The second common mistake is the one that can cause you the most harm, and it's enrolling in Medicare Part B when you don't have to. Now, this has to do with people who are continuing to work past their initial enrollment period and have employer group coverage. The general rule is to never, that's a big word, but absolutely true, never enroll in Medicare Part B until such time as you wish Medicare to be your primary insurance and you are discontinuing creditable employer coverage. Here's why. On the day your Medicare Part B becomes active, a 180-day countdown starts. That's a 180-day window where you can apply for and are guaranteed to receive any Medicare supplement available to you with no health questions asked. You're guaranteed to get any Medicare supplement plan that is available to you in your area at the insurance company's best price. After that 180-day window has closed, in all but a few states, the insurance company will require you to go through medical underwriting, and then they can deny you coverage or increase your price based on your medical history. Most Medicare agents will refer to the Medicare supplement initial enrollment period as a 6-month window, and that's not entirely accurate. It's 180 calendar days, which can be a few days short of 6 months. We've seen this become an issue a number of times with people who procrastinate until the very last day. You see, all but a few insurance companies hold you to that 180-day limit. So please don't wait until the last minute. The enrollment period is not 6 calendar months, it's 180 days. Now, I have a free calculator on my website where you can see your Medicare supplement initial enrollment period, and it's in the same area, the same drop-down menu, under the Resources tab that the initial enrollment calculator is found. So this time, Just input your Part B start date, and it will show you when your Medicare supplement initial enrollment window closes. The mistake we see time and time again are people who have enrolled in Medicare A and B and continue with employer group coverage. Then years later, they want to retire and they begin to shop for Medicare supplement and learn they can't get one. Unfortunately, something happened medically that disqualifies them from acquiring a Medicare supplement. Remember, it's past that 180-day window, so they're required to qualify medically. So now, because they chose to get their group coverage instead of a supplement, their only choice is to just keep Medicare A and B by itself and add a prescription drug plan, or trade in their Medicare A and B for a Medicare Advantage plan. That's it. They lost their option to add a Medicare supplement. Thankfully, there are a few states where if you make this mistake, the state allows you to get a guaranteed issue Medicare supplement plan. But your choices are limited, and only a few states actually have a law that requires this privilege. Now, this next mistake that I'm going to cover is surprisingly common and can lead to a permanent penalty. Before I cover that, I would like to ask you a small favor. If you haven't yet, please click the like button below and subscribe to my channel and be among the first to see my new Medicare videos, in addition to seeing the many videos I've already produced. There's a lot of information, and I know you'll find it useful as you enroll in and use your Medicare in the years ahead. So let's look at mistake number 3. Now, mistake number 3 is kind of related to the mistake we just covered. It's regarding those who choose to continue with employer coverage after their initial enrollment period. But this one leaves people without a Part D prescription drug plan. The mistake is thinking that because they have 180 days, your 6 months from the start of Medicare Part B, to choose a Medicare supplement plan without medical underwriting, that they also have 180 days to choose a Part D prescription drug plan or Medicare Advantage plan. And that is not the case. To best understand and remember this, I want you to remember this one feature of Medicare enrollment periods. When we look at periods after your initial enrollment period, the Medicare supplement initial enrollment period is linked to the start date of Medicare Part B outpatient coverage. That's the 180-day or 6-month window we spoke of earlier. Conversely, Medicare Part D prescription drug plans and Medicare Advantage plan enrollment periods are linked to either your Medicare Part A inpatient care start date or the last day of creditable employer health care coverage. Typically, you have 63 days from the end of you or your spouse's employer group health care to enroll in either an Advantage plan or standalone Part D prescription drug plan. Neither plan ever has medical underwriting. They just have a strict limitation as to when you can apply. You must have a valid enrollment period to apply for either a Part D prescription drug plan or a Medicare Advantage plan. You do not have or need an annual enrollment period for a Medicare supplement plan. You can enroll in a Medicare supplement plan at any time, 365 days a year. Of course, you may be required to qualify medically outside of your initial enrollment period. Just remember, only Medicare supplement plans have a 6-month enrollment period. Everything else is closer to 2 months. The fourth mistake is really quite simple. On occasion, we see people who have delayed their Medicare only because they wanted to wait until they collect their Social Security income. In some cases, they believe that they can't get their Medicare without also starting their Social Security. Medicare and Social Security are not linked. You can have Medicare and not Social Security, or Social Security and not Medicare. Most people become eligible for Medicare as they turn 65. You cannot get Medicare under 65 unless you're permanently disabled. But you can collect your Social Security starting at age 62 up to age 70. So Social Security and Medicare are not linked. Don't mess up the enrollment in one for the other. Our last common mistake happens with people who are in their first few years of Medicare as much as it does with people who are new to Medicare. In fact, many insurance companies encourage this confusion in order to generate more business. So here's what's going on. Every year between October 15th and December 7th, Pearl Harbor Day, is Medicare's annual open enrollment, or also called the annual election period, or sometimes just referred to as AEP. This enrollment period is only for people who are past their Medicare initial enrollment period and already have either a Medicare Advantage plan or a standalone Part D prescription drug plan, or want to get one. So this is important. If you're new to Medicare and your initial enrollment period is upcoming or concurrent with the annual enrollment period, then the annual enrollment period is not relevant to you. It's only for people who are past their initial enrollment period and have either an Advantage plan or a Part D prescription drug plan, or again, they want to get one. So why is this? The reason for the annual enrollment period is to give those enrolled in Medicare the opportunity to research the costs and benefits of next year's plans, then choose the ones best suited for them. In other words, it's only for those Medicare plans with changing benefits on an annual basis. Medicare Advantage plans and Part D prescription drug plans are annual plans that operate on a calendar year basis. Their benefits and costs can change every year. Every feature of your Medicare Advantage plan or Part D prescription drug plan can change every year. Now contrast this to a Medicare Supplement plan. Medicare Supplement plan benefits never change, ever. The benefits are written into Social Security law. In order to make a change to a supplement plan feature or benefit, it will take an act of Congress signed by the President. Even then, it cannot change existing plan benefits, only plans yet to be purchased at some point in the future. And that is why there's no need for a Medicare supplement annual enrollment period. You can change your supplement plan at any time. You're simply required to qualify medically through a medical underwriting. Conversely, you never have medical underwriting or medical questions with Advantage plans and Part D plans, but you can only change those plans during select enrollment periods. So what is all the hype with the millions of dollars in TV commercials during this annual enrollment period? This is important to understand. It's because insurance companies want you to change plans. Insurance companies, insurance agents won't make a sale unless you decide to change plans. If they can convince you to make a change, they have the opportunity to make money. Keep in mind, the annual enrollment period has nothing to do with your Medicare supplement plan. You do not have to do anything with your Medicare supplement. That policy will simply continue until you decide to change it. Now, personally, I believe that you should always check your Advantage plan and Part D prescription drug plan benefits every year. You do that to protect yourself from changes that may increase your costs or reduce your benefits, but you're not required to make any change. If you do nothing, your plan will simply roll over to next year's versions of your existing plan. So there you have it, common mistakes that are easy to avoid. Just remember, you can research your Medicare initial enrollment period on my website, MedigapSeminars.org, under the Resources tab. The same with your Medicare Supplement initial enrollment period. Also remember, your Medicare Supplement enrollment period is always linked to your Part B start date. Reach out to MedigapSeminars.org if we can help you with any of your specifics and help you with your situation. I'm Matthew Clausen at MedigapSeminars.org. Thank you for watching.